classroom may batas, bawal lumabas o bawal lumabas. Pero pag sinabing pag nag-comply ka na bawal lumabas, pero may sinap, may ginawa ka sa pinagbabawal nila.
Have a great day, everyone. Welcome once again to Academia Gonzaga, and this is the Instructor's Compass. As of this moment, we will be tackling the topic Introduction to Biological Assessment. Now, please give me 1 minute to put on our PowerPoint presentation. Okay, here we go. Again, this is the Bridging Education for Biology, and we are now tackling the topic Introduction to Biological Assessment. Once again, this is your online instructor, Sir Noy Gonzaga. My real name is Prospero G. Gonzaga Jr. I am a registered nurse, a licensed professional teacher, and I am teaching at Central Philippine Adventist College General Education Department. Now, for the first part of our lecture, let us have the vital signs. Actually, we'll be tackling two topics under biological assessment, the human positioning and the vital signs. Okay, so for our first part of the lecture, we will have the human vital signs. Vital signs are called signals of human life and normality. By the way, before I forget, there are 4 basic vital signs that needs to be recorded every time we are assessing a human being. And these are, number 1, temperature, number 2, blood pressure, number 3, pulse rate, otherwise known as heart rate, and number 4, respiratory rate. Now, temperature can be abbreviated as temp, T-E-M-P, blood pressure, BP, that is B and P, pulse rate or heart rate can be abbreviated as PR or HR, and respiratory rate is abbreviated as RR. Okay, now let us go to the first vital signs, which is pulse rate. What is recorded there? 60 to 100 beats per minute. BPM is beats per minute. This is the normal pulse rate. So if you will record pulse rate later on, and that is ranging from 60 to 100, that is normal. Now, let us try to explain pulse rate deeper. Pulse rate is the rate of the heart that reflects its circulation. Thus, a pulse rate is also called a heart rate, for it is the same measure. This is the rate of pumping of the heart or the pulse in your hand in 1 minute or 60 seconds. Now, a general normal pulse rate is between 60 to 100 beats per minute. When you are lying down or resting, usually your pulse rate or your heart rate is 60 to 80 beats per minute. When you are in active position, that means you are standing, walking, or doing something, your heart rate will be 80 to 100 beats per minute. By the way, BPM, the abbreviation BPM means beats per minute. Now, let me first qualify it here. When you're measuring from the heart, you will hear the sounds labdab, labdab, labdab. 1 labdab is 1 heart rate. Remember that. It's not 1 lab and 2 dab. No? So, dadan, labdab, that is 1 heart rate. Okay? But if you're measuring from the wrist or from the parts of your area that has pulse, you can hear only 1 sound. So 1 sound is equivalent to 1 pulse rate. Okay, let us move farther. How do you take your pulse rate? Okay, so you can just put your hand directly in your chest area to feel the rate of the heart. That will be very usable. But in normal situations, we get the pulse rate from the wrist area or below the palm. Now, here is your procedure. Use the second and third finger in measuring the pulse rate area. When you say measuring the pulse rate area, you locate the feeling that there is a bounding pulsation. Now, there is a movement. Now, avoid using the thumb, for it has its own pulsation that may distract the process of getting the pulse rate. So you cannot see people using using to get pulse rate their thumbs. Okay? So again, another reminder, take the pulse rate with the straight unfolded hands. That means it should be like this. Okay. Okay, straight should be like that. Okay, not like this. Okay. Now, because if that is straightened, circulation is normal. If that is folded, there's a tendency that you will measure a falsely low pulse rate because the circulation was disrupted. That is the main reason. Okay, the third procedure, locate the pulse rate at the open wrist area. Okay, this one, you locate it here. Okay, and see to it that it is stable and not sporadically missing. Now, when you can locate a pulse rate, but now and then it is getting lost, that means you are not still in the accurate proper area. You still have to look for that area wherein the pulse is very strong and it is not already disappearing. Now, number 4, you now measure the rate in 1 whole minute. So you count how many pulsations, pulsations are there. In the heart, if you will use the heart, you count how many love-doves are there. Okay? Now, after that, record your output. But when writing the result on paper, don't forget to write the unit of the pulse rate because that is important. So, example, you counted for 1 minute and the result is 75. So you put there 75. Don't forget the unit. That is BPM, 75 beats per minute. That is the most accurate and correct way of putting the result of a pulse rate measure. Now, let's go to the, okay. Here, I only want you to know the terminologies because we can still discuss disease related to these conditions because we are not studying pathophysiology here. We are only informing you about the vital signs. So if in case you'll be asked in measuring abnormality of the pulse rate, here it is. When your pulse rate is lower than 60 beats per minute, this is called bradycardia, meaning slow pulse rate. When you can measure a pulse rate higher than 100 beats per minute, this is called tachycardia, meaning very fast pulse rate. Again, 60 to 100 is the normal range of human normal pulse rate. So lower than 60 is abnormal, bradycardia. Higher than 100 is also abnormal, that's very fast, that is tachycardia. At least you know the terminology by now. Now, the second vital signs here is the respiratory rate or the RR. Okay. Now, in some books, that is 14 to 20 cycles per minute, the normal range. But we will be taking in, because there are many books that are saying that it's 12 to 20 cycles per minute. Whatever that is, we will take the average. So the normal respiratory rate is between 12 to 20 cycles per minute. Now, what is a respiratory rate? A respiratory rate is the rate of breathing of a person counted in a whole minute. This is measuring the normality of the lung usage in terms of the breathing process of your body. So just to put it simply, respiratory rate is the count of your breathing. Okay? When you breathe in, when you breathe in, the chest rise and the chest fall. One rise and fall of the chest because of breathing is called a respiration. Okay? So you will count all those respirations in a period of 1 minute. It would be very much suggested that the person being subjected to respiratory rate measure will not be informed that you are counting the respiratory rate so that they will not be conscious enough to falsify the result. Remember, dear learners, if you will tell the person I'm counting your breathing, the person will try to make fun of you, will make the breathing fast or will make the breathing slow. And this is affecting the result, which can later on let the doctors or the nurses read a false normal or a false abnormal result, which is not good for your assessment. So again, as much as possible, they should not know that you're taking the respiratory rate. However, after the procedure was done, you have to tell them that you have recorded the respiratory rate because it's their right to know every procedure done to them. Now, how do you get the respiratory rate? Number one, go to a position wherein you will see the rise and fall of the chest of the person you are to take the respiratory rate. So what are these positions? There are three positions. Number one is the supine or the lying down position. Number two, you can have the sitting position. Or number three, you can have the semi-fowlers or the slightly bending position. All of these three can be possible for measure of the respiratory rate. Then count the respirations of the person in 1 minute. What is again respiration? This is the rise and fall of the chest because of breathing. So one rise and fall is called one cycle, and that is one respiration. Remember, CPM in respiratory rate, okay, stands for cycles per minute. So one cycle is actually one rise and fall of the chest. Remember, the person should not be conscious, okay, that you are taking the respiratory rate, or else they will falsify it, and that will not help in the medical assessment. You are also to take the respiratory rate, okay? You can also take the respiratory rate after taking the pulse rate, okay? And by just holding the hands of the person, you put your hand near the abdomen of that person, and the person do not know that you are already feeling for the rise and fall of the chest area, and that is already the count of the respiratory rate. This is using your mind to get a very accurate result. Okay? Now, when writing the result on paper, do not forget to write the unit of the, I'm sorry, this is wrong, respiratory rate, that is CPM. So example, you count 17 breathings per minute. So the record will be 17 CPM or 17 cycles per minute. Now, let me qualify it here. Okay? I'm sorry, I was lost for a while. Now, let me clarify it here. When you are recording, when you are taking the pulse rate, the patient cannot alter or cannot make fun of you when you're taking the pulse rate because it's the heart that controls the pulse rate. But when you are taking the respiratory rate, the person you are trying to take the respiration count can actually alter the respiration. So these are the comparisons of the differences in the ideation of taking the pulse rate and the respiratory. So beware. In the pulse rate, it doesn't matter if they know or not, but in the respiratory rate, there's a tendency that you can record a false correct or a false normal or a false abnormal if the person knows that you are taking the respiratory rate. Now, the normal respiratory rate in some books is 14 to 20, in other books 12 to 20. So you'll be taking 12 because most of the book are saying 12 to 20 cycles per minute. So the abbreviation CPM, to remind you again, is cycles per minute or one breathing per minute, or what we mean is one rise and fall of the chest per minute. The rise and fall of the chest is equivalent to one breathing. Now, so here we will try to see some abnormalities again for terminology's sake. Okay. If the breathing of the person registers only lower than 12, in some books 14 cycles per minute, this is called bradypnea, meaning slow respiration or slow breathing. If the measure is higher than 20 cycles per minute, meaning the breathing count is more than 20 or the cycles per minute of the respiration is more than 20, this is called tachypnea, meaning fast respiration. So this is only for terminological consideration. The third vital sign is blood pressure. Now for this one, I cannot teach you this one because this is yet to be taught in the fundamentals of nursing or fundamentals of medical subjects. But I will just tell you here the background of blood pressure. Blood pressure is being measured by an instrument called sphygmomanometer, or commonly called BP apparatus. Okay? You cannot take blood pressure without the BP apparatus. That is illogical. So the lower normal of the BP, if you'll take it, okay, in the arm area, that is 90/60, and the upper limit is 120/80. The higher number is called systolic, the lower number is called diastolic. Now, if your BP will range within that area, that is normal. Okay, now let us proceed. As what I have said earlier, when you will take the BP, use the BP apparatus for it, or your blood pressure monitoring will be useless without the use of a BP apparatus. Now, when the patient goes to you for BP monitoring, let the patient relax first for 5 minutes before taking. Why? Because a person who has just walked or do something is understood to have higher activity, and that might affect the BP. It might go very high, but it is not really pathologically high. It's just high because the person has activity. So this is why we have to let the person rest for 5 minutes before taking the BP. Now, if your BP is higher than 120, that is called hypertension. If your BP is lower than 90, that is called hypotension. Now, beloved learners, high blood pressure is one of the common diseases in the Philippines, especially in Philippines. And this is caused by stress and diet. Two of the greatest causes of high blood pressure or hypertension is stress and diet. Well, Filipino diet is full of fat, oil, cholesterol, okay, soft drinks, and all of this kind. And this can all elevate our blood pressure. Lastly here, we have temperature. In the Philippines, we are mostly using degrees Celsius as the unit of our temperature. In other countries, they're using degrees Fahrenheit. So that is F. So for your consumption, you can just look at the internet for conversion to Fahrenheit. This Celsius is also called degrees centigrade. So 36.5 to 37.2 degrees Celsius is normal, but the average normal is 37 degrees Celsius. During these times, temperature is very, very important. If your temperature is higher than 37.2, that is a sign of a viral infection. And the greatest viral infection that we have now is, okay, the COVID pandemic. That is why today, malls, dining halls, fast foods, buildings, they are armed with temperature because you cannot enter when your temperature reads 37.3 and above. Okay? So, how do you get the temperature? You are to use the thermometer. We have so many thermometers now. We have digital thermometers. We have also gun thermometers. We will just locate it somewhere near the head and you can read the temperature. But we will be using for our consumption the mercurial thermometer, the common one that we see in the hospital, or the digital thermometer that we are using now. So areas of frequent measure, usually in the hospital, it's the armpit, the mouth, or the anus. However, today, we don't use the mouth because of the viral pandemic. We don't use the anus because we don't want to expose the person. So we are using the armpit. However, science would like to tell us that mouth and anus results are far accurate than the armpit. However, the armpit is not really that inaccurate. And what the reading is already enough to really determine if there is actually a temperature change or a temperature abnormality. Now, increased temperature or temperature higher than 37.2 is called hyperthermia. Temperature lower than 36.5 is called hypothermia. Okay? Now, why are we taking temperature? Temperature is very important to humans. Why? Because we are warm-blooded organisms and we need heat in order for blood to circulate. When there is no heat, there is no circulation. When there is no circulation, okay, areas of the body will result to stroke. When there is stroke, areas of the body will not receive oxygen. And when the body cannot receive oxygen, the body will die. So temperature is vital to human life. Okay. So let us have first a short break, and we will just be back in a little while to tackle the second part of our discussion. So we will be learning about human positioning and the terminologies that are being applied in here. Let us first consider the bed positions. This position wherein you are lying flat on the bed, heads up, this is called supine. Okay? Supine position is when someone is in supine position, okay, he is lying on his or her back. So the purpose of supine position is if you are examining the front side of the body or the frontal body parts. The second here, you have the prone position. Okay? Prone position is when someone is on prone position, he is lying face down on the bed. The purpose of this body position the purpose of this position is when you're examining the back parts of the body. So the back of the skull, the back of the, the back of the chest area, the butt, okay, and then areas or skin at the back of the area. Next position is the right lateral, recumbent. If you notice here, this is not a normal right-sided position, right? But the knees are a little bit bent. That is why you call it right lateral recumbent. So side lying, but the knees are flexed a little bit. The patient is lying on their right side. This is also called right side lying position or right lateral position. So when you're lying on the right lateral position or right lateral recumbent position, okay, the purpose of this is you will examine the left part of the body. So when you're lying on the right, you're actually exposing the left. So here below, you have the left lateral recumbent, also called as the left side lying position, also called as a left lateral position. Okay? Now, because you are lying down on your left, the purpose of this is if the doctor or the nurse would like to check on the right side of your body. Okay, that's why you have the right lateral recumbent and the left lateral recumbent positions. Next, you have the Fowler's. Okay, one of the term for Fowler's position is sitting position. Fowler's is actually high back rest also. Okay, so this is Fowler's. A person in the Fowler's position is sitting straight up or leaning slightly back. Their legs may either be straight or bent. So when you're sitting on the chair, okay, that is actually a Fowler's position. Okay, so this position is being used or suggested for people who will be eating. Okay, for normal people to eat. Okay, next position here is Trendelenburg position. If you notice, Trendelenburg position is just supine position. However, this time the head, the foot or the feet is higher than the head. Okay, Trendelenburg position is lying supine with their head slightly lower than their head. Okay, one of its use is when you have hypotension or low blood pressure level. So in order for the body to have equilibrium or to have more blood presence at the upper area, then you position the person this way so that blood will, by gravity, go back to the upper area of the body. And this is called blood refill. Okay. So when you take the BP and the result is hypotension, you position the person at Trendelenburg position, but because of gravity, blood will go to areas of the body that are on the higher part of the body. That is Trendelenburg position. Next, you have the fetal position. If you notice, okay, the knees are, raised upward. The elbows are hidden. The head is twisted. That is the fetal position. We call this the fetal position because this is the position of the fetus or the baby inside the ovary or the reproductive system of the mother. So fetal position is next, knees flexed touching the chest area and hands also flexed like a fetus in the uterine cavity of the mother. Usually, this is to expose the spinal cord in inserting spinal anesthesia. So this is one of the usage. There are many usage. So if you want this area to be highly exposed, fetal position is a very good way of exposing that area. Remember, this area has a lot of bones, and the bones here are segmented. So if you want to expose this area, you do the fetal position, the segments will have little spaces, and it will be easy for doctors or anesthesiologists to insert the needles. Okay, next position is the semi-Fowler's position. If you notice, the semi-Fowler's position is a cross between supine and Fowler's. So it is actually in the 45 degrees. It's in the middle. The semi-Fowler's position resembles a 45 degrees bending position or a position between supine and Fowler's position. This is indicated for weak patients, for this will enhance circulation without giving much pressure to the head. So again, you want the body to have level circulation, but of course you have to elevate the head because you don't want high pressure on the head because that will make the person unconscious. Okay? So you elevate the head and the rest of the body is in supine position. You call that the semi-Fowler's position. Okay. Next, you have the Sims. Okay. In our dialect, we call this position as tanday position. You know, if you have a pillow there at the other side and you raise the upper leg and then put it directly on the pillow, you call that the tanday position. Kepang tanday. Okay. Sims, okay, if you notice that one, okay, it is actually not supine, okay, not also prone, okay, but it is actually exposing the back area. Okay. So Sims is a semi-side lying, semi-prone modified position aimed to expose the anal perineal area. So this is the area you are exposing in Sims. So when there will be anal checkup, okay, hemorrhoid checkup, okay. So this is usually done for rectal and anal complete examination. Now, the next position here is the reverse Trendelenburg position. You notice Trendelenburg is this one, the gray. This is reverse Trendelenburg, where the head is held higher than the feet area. So this is done by elevating the head while lowering the feet in a slanted motion. Okay? So in this case, it can be used for immediate relief to hypertension or any increase in intracranial pressure in injury. Meaning, the purpose now is to let blood or circulation or what do you call it, blood presence or blood pressure presence from this area going down so that this area will be free of pressure, okay, so that the brain can move and then hypertension will be controlled. So this is reverse Trendelenburg position. Okay. Our positions are getting interesting and interesting. So this is actually dorsal recumbent. Now, dorsal recumbent is just supine position and you raise the knee. Okay? Actually, these two are similar. The only problem is when you are at home, you can only do dorsal recumbent because you do not have a steer up. You call this machine, you call this mechanical thing here, this black one, as a steer up. So when you have a steer up and you put your feet on top of the steer up, this is still a dorsal recumbent position with a raised leg, but the term now is called lithotomy position. So this is dorsal recumbent. This is lithotomy position. Okay. Now, let us go first dorsal recumbent. This is a supine position with knees flexed and perineum. When I say perineum, this is the area where you see the vagina, okay, area there, okay, and then the lower part of the navel area, that's still part of the perineum. So this is a supine position with knees flexed and perineum exposed, often used if delivery is not within healthcare system. Okay, as what I've said earlier, Okay, this is only at home. This is used for birthing at home and also for upper vaginal exam. So for vaginal exam, you let the person position this way, and then you check the vagina. You check for male, you check the penile area. Okay, this is a perineum check position. Now for lithotomy position, this is a supine position with legs anchored to a stirrup or brace to expose the perineum while on delivery or perineal test or procedure. Actually, the two are just what? Similar. This one has a better view. This one has, shall we say, a good view, but it could have been improved with a stirrup. So technically, this is hospital position. This is home position. Okay? This is highly suggested for hospital delivery and DNC, or what we call RASPA. Okay, DNC means dilatation and curettage. Or sa atin dialect is, this is RASPA. Okay. So those are actually the most common positions that you will meet someday when you'll be talking about biological positioning. So let us review. You have supine, prone, right lateral recumbent or right side lying, left lateral recumbent or left side lying. You have Fowler's, you have Trendelenburg, you have fetal position, you have semi-Fowler's position, you have Sims position, and you have reverse Trendelenburg position. And the two special position, we have the dorsal recumbent and the lithotomy position. Okay. Now, we have additional topics here of which I want you to know, okay, so that you will be informed as part of this lesson. Let us try to see some of the things that you need to know. Now, here is a human body. Now, in biology, we need to describe the human body, and we cannot call it front, back, left, or right. We have biological or medical terms really suitable for it. So when you're talking about the position upwards, you call that superior position. Okay? When you refer going down, that is caudal. Okay? So you say the head is superior to the feet, and the feet is inferior to the head. Okay? Now, when you're referring to the front of the body, that is anterior. When you are referring to the back of the body, that is posterior. So let us give example. So the chest is anterior to the back. Okay? The back of the body is posterior to the chest. Okay. So that is how you name terms. It's quite hard, but the meanings are just the same. Okay. So when you're talking about the side of the body, the side that is lateral, when you're talking about the center, that is medial. Okay. So you will say the hands is lateral to the body while the chest is medial because it's in the middle. Okay. So I just want you to familiarize this one now, but this will be deeply or more exaggerated and emphasized when you will be learning about health assessments. Okay. Next. Okay, so this is another example of superficial and deep. Okay, when you say superficial, it's just skin level. When you say deep, it's below the skin level. Okay. Now, when you're describing a person from head to toe, you call that cephalocaudal. When you're describing the person from one hand to another hand, or from one length or one side to another side, that is proximodistal. Okay, so when you say, oh, I am here. Of the three, I have the least cephalocaudal appearance. Okay. But I am not the smallest proximodistally. Okay. I hope you get what I mean. I am not the thinnest, but I am the shortest. Okay. So in biology and medical terminology, cephalocaudal is the measure from head to toe, while proximodistal is from the left to the right or right to the left. Okay. We have some terminologies more here. Elbow is distal to the shoulder. So when you talk about this area to this area, that is distal, okay? While the shoulder is distal to the elbow. Okay, nice to know terminologies. Now, also in your stomach as big as mine before, but now my stomach's up to big already. Now, the stomach is divided into 4 quadrants. You call this one the left, the right, upper quadrant, of course, because you're facing me. Okay, the right, I'm sorry, again, it's the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Okay, so the purpose of these quadrants is, okay, you can use this later on to describe which area of your stomach has pain, which area of the stomach has, what do you call this, sensation of bloating, okay? And the doctors also use this to have a medical perception that if you have a pain in the right area, lower quadrant, it might be appendicitis. Okay, di ba? Because they can estimate that the appendix is here in that quadrant. So we're using the quadrants to discuss the area location of body organs and of the symptoms. Okay. So here is the sagittal planes again. Okay. So when you call it sagittal planes, the description is left and right. Yes. When you say coronal planes, that is front and back. When you say horizontal planes, up and down. Okay, so that is how you describe a person. Okay. Let us have more additional knowledge inputs here. Okay. When you put your hands up, and this is flexion, this is extension. Okay, flexion, extension. Okay, when you put your hands sideways like this, okay, this one, this is abduction, this is adduction. Okay, you will just be familiar with the terminology, dear learners. Okay, when you move your feet inward, that is medial rotation. When you move your feet, okay, outward, that is lateral rotation. Okay, so when you put your palm this way, that is supination, and this way is pronation. Okay, just like the description when you are also lying on bed. Now, when you touch the fingers, that is called finger opposition. When you are trying to move in circles parts of the body like this, that is rotation. Okay, when you are moving your head sideways or around, that is head rotation. Okay, when you are moving your hand, your hand is normally like this. When you put it like that, that is hyperextension. Okay, so these are just terminologies that I want you to be familiar, because you will still meet most of them when you will already study medical education. It might be nursing or other medical fields. Okay, so thank you very much for listening. I hope you have learned so much from this discussion that we have, which is biological assessments. We assess person with the use of vital signs. We assess persons with the use of positioning. We assess persons with the use of body movements. That is why it is important to know how this works, so that in the future, when you will be assessing persons already, you will have complete knowledge of doing so. So, God bless everyone. I really enjoy this time discussing things like this with you, even if I cannot see you. Why? Because I know, okay, that with the help of this subject, you will become great health providers in the future. So, again, it's time to end the lecture. And if you have questions, feel free to ask me on Messenger. Have a great day, everyone. Learning time is over, but I hope and I pray that you will review everything that we have studied so that it will be inculcated in your minds. This is still Sir Noy Gonzaga, your online instructor, your nurse friend, and I'm very happy to be of help to you in this subject. Biology, breathing.
Ulo ng classroom nyo at sinapit mo ulo